The biggest surprise you're going to hear today is that the York General Healthcare System is at the cutting edge of healthcare in Nebraska and in the middle of the upper Midwest, by the way. Thanks for watching WowBiz TV. My name's Lynn Hinderaker, and I am here in York, Nebraska. Now, that's in central Nebraska, about 8,000 folks here in this community, but it seems when you take a look at the sophistication of the healthcare system in this particular community, you feel like you're in a 30,000 or maybe a 300,000 metro area because of the vision and the progressive commitment and investment in the future that you're going to learn about right now. We've got two different doctors here, and both of those doctors are related, but they do completely different things. So I can't wait to introduce you to Dr. Dan Growney over here. He's with York Medical or Surgical Associates. He's a surgeon. And then, of course, Dr. Todd Stuckey over here to my left. He heads up the York Medical Clinic. He's a family practitioner, right? Dr. Stuckey, let's start with you for a second because I'm so excited to meet you. You took some time recently to explain to me, I hate to use this phrase, by the way, paradigm shift. It's a bit of a cliche, but we all know that healthcare is going through incredible change. Some people are being left behind. Some people are very excited about it. Tell us a little bit about the healthcare model that, as president of York Medical Clinic, you're kind of helping up and shaping this community with this. Go ahead.
Well, there's a new concept that has been introduced across the country.
Yes. That
we are really taking part in and believe in, and that's called the patient-centered medical home.
Let's say that again, patient-centered medical home. So is the home your clinic or is the home their home and you have a closer relationship? How should we interpret that phrase?
Yes, it's more of a concept, and it's a comprehensive approach for us to deal with children, adolescents, and adults.
Okay. And just real quickly, because I'm going to go talk to Dr. Growney in a minute about that progressive surgery process and the commitment over there, but very briefly, how does it vary? Is it more holistic, more preventative, more expensive, less expensive? But if you had to boil it right down to one thing to explain the shift and this new concept, what would it be?
This is a partnership or an ownership in a relationship emphasizing prevention.
Okay, so a partnership and prevention, two key words there, huh?
Correct.
All right, well, Dr. Todd Stuckey, I'm going to be back in just a minute. I'm going to go talk to Dan Growney because you actually have some patients that you will send over to Dr. Growney occasionally. Is that correct?
Absolutely.
Yeah, he's a reliable surgeon. Let's go talk to him because I want to understand how the entire system is progressive in various areas and branches, and you're very interdependent. Dr. Growney, tell me, you've been here 20 years or so. You know the operation intimately. Tell me, what would you tell somebody who is coming to work here or maybe going to work in your department or with you? Define this operation for us very quickly and succinctly.
Well, Lynn, I think one of the most important things, and one of the things I'm proudest of, and particularly proud of being part of the organization, is that the organization is very focused on being very progressive and maintaining, cutting edge technology and being on the forefront of healthcare.
And that's a little unusual, frankly. I just want to reiterate this. I said this at the beginning of the interview. That's not necessarily what people would expect when you talk about an 8,000 community in central Nebraska. Go a little bit further with that. Can you give us maybe a little more examples? They're just investing in technology, new procedures, facilities, what?
Absolutely, Lynn. The hospital is always willing to make sure that the equipment we have is the most modern, cutting-edge equipment that's available on the market.
Yeah.
They are bringing in new procedures as they become developed. They make sure their staff is trained in the cutting-edge technology.
That's important. Yeah,
absolutely.
Just summary, does it allow you to do your job better? Really?
No question.
Really?
We're using good equipment, new equipment, and we can do things that, less forward-thinking institutions wouldn't be able to do.
Is that right? Fantastic. Well, I'm going to go over here and talk to Dr. Stuckey for a second. Now, he's assured me that they're doing an outstanding job over here. So let's dive into, let's say, for instance, I come to your facility, York Medical Clinic, and I get involved with you. What's going to happen in step 2 and step 3 as we go deeper into your model? I'm buying all the way in. Am I going to hear from you? Am I going to come back more often? Am I going to spend a lot of money? How should I think about it?
Well, this concept that we're instituting and we're endorsing, some analogies that seem to make sense to me and others is in your automobile mechanic situation, they would like for you to bring your car in, have the oil changed. They're doing some maintenance things to prevent bigger problems.
On kind of a regular basis.
On a regular basis.
Are you talking to me like this because I have an old car and I need to step up my preventative maintenance? Is that what you're trying to tell me? No, I'm just kidding you. But no, we understand the value of doing that. But people put that off, don't they?
They do. They do. And it's all of us are guilty of that. But we try to certainly emphasize the preventative end of things. The other thing that we're trying to emphasize in this model is maybe you could think of as an airline pilot. When an airline pilot gets in and gets ready to fly, he doesn't just hope for the best. He has a checklist of numerous things to complete. By human nature, if you've got a list of 50 things to do, it's easy to leave off number 47. So we are certainly using electronic medical records to help us enforce that.
I didn't know where you were going, but of course is electronic medical with HIPAA and all that, has that all come together now? Is it a usable operational model at this point? Because I know several years it's been a little bit debated and so on.
Exactly. Every year that goes by, it gets better and better. In the office setting, we're in year number 9 for us. So it's really come a long ways.
So am I going to recover sooner under your care, assuming that I conform to all the tenets or the elements of this thing, or am I just not going to get certain ailments that I might have otherwise gotten because I wasn't aware of them? Or is there more diagnosis here? Or tell me a little bit more about this, because I'm intrigued. This is big.
Well, we'd like to think all of the above. I guess specifically, we'd like to try to keep you healthier to begin with.
Yes.
But then if you do have to visit the emergency department or the hospital setting, we would like to not wave goodbye when you leave, but we want to follow up quickly. We want to make sure you understand your medicine list. We want to make sure you get to the follow-up appointments that you're supposed to. So we've added specific employees to full-time track these people down and to facilitate.
Build the relationship to a partnership level.
Right.
And when you use the word partnership, that implies accountability, right?
True.
You're taking some I guess, responsibility for their general overall wellness. Isn't that correct?
True.
Am I pushing it too far?
No, we would like to take ownership in that and play our part if people would be interested in pursuing it. So,
just one quick question, then I want to come back to Dr. Dan. What about the insurance companies? Do they buy into this, or do they resist it and not cooperate? I'm just curious.
They are. Naturally, it's a new concept to all of us in the last few years.
Sure.
We have been partaking in this for probably a couple years.
Okay.
But the insurance companies are becoming more and more aware that this idea is worth it.
They're kind of on board, and they see the benefit for them as well.
Correct.
All right. Well, I'm going to take that metaphor with the auto mechanic, right? And I'm going to come over here again to Dr. Dan, because I know we'll have a good time chatting about this. You know, when you go to the garage and you kind of look in and watch the garage, you know, the mechanic, he's down in the engine and so on. And a lot of them have technology, right? They have computers and different things, diagnostics, and you watch some interesting graphics and find out whether or not, your engine's performing correctly. I know you take advantage of metrics and measurements and so on, insofar as defining how good we're doing over here at York General Healthcare. Tell me a little bit about the metrics and the measurements.
This actually dovetails very nicely into what Dr. Stuckey was talking about those the checklists to make sure that you're following the rules.
Okay.
And at York General, it's they're able to measure how we're doing in following the rules to keep people. They've determined what it takes to keep people healthy, like your immunizations and your infection prevention, and to make sure that your cardiac patients are on the right medications when they leave the hospital. Yeah. Those are actually federal guidelines that we're proud to follow because they are shown to work.
You know, I don't ever hear anybody talking about this. I'm sure this is true for, everybody to some degree, but I've never heard a surgeon bring this up and say, we really consciously conform to these things and stay abreast of them and so on.
Absolutely.
I think I'm impressed by that. I'm not sure.
Well, and we're actually able to compare ourselves, since we follow these guidelines.
Sure.
We're actually able to compare ourselves with other hospitals around the country. And I'm very impressed with
yourself. You're doing well, aren't you?
With how hard York General strives to stay at the top tier of all the hospitals we're comparing ourselves with, because it means we're doing things right. And they have these dashboards that compare hospitals to one another.
Yes, this is what I was talking about when I was coming over here to you.
Yep, absolutely. And York just does their absolute darndest to stay in the green at the very top of those tiers.
Is that top tier?
Yeah, absolutely. To make sure that we are as good or better than all the other hospitals we're comparing ourselves with.
That's incredible. It's got to make you feel proud to see the reports and stuff like that, and deepen your commitment to continuing the best practices.
Yes, absolutely.
All right. Well, Dr. Todd Stuckey and Dr. Dan Groundy, I am so impressed with the both of you. You're doing related things, but different. You both are striving to reinvent the profession that you're in. You have incredibly high standards. It seems consistent with the York Healthcare System's standards of operations and so on. You've really got an exemplary operation out here, and I want to congratulate both of you, and thank you for cooperating with me on this group interview here. Thanks so much for watching WowBiz TV. I'm Lynn Hinderocker. I'm in York, Nebraska. We'll see you again.